Good evening, everyone. I'm Dr. R. Renita, presenting to you a case report on ciliary body melanoma. A 53-year-old female presented with complaints of gradually progressive, painful loss of vision in the left eye for 6 months. History of redness, watering, and severe excruciating pain was present in left eye, which was subsided with medications. There was history of headache and no history of flashes or floaters. On general examination, the patient was moderately built and ill-nourished. There was no pallor-icterus cyanosis, clubbing or lymphadenopathy, and the vitals were stable. On local examination, there was hyperpigmentation of the skin over the eyelids, forehead, cheek, temporal region, and the left side of the face. Head posture was normal, face was asymmetrical. On examination, the right eye vision was 6/36, and the rest of the examination was normal. The left eye examination, the visual acuity was perception of light was present with projection of light accurate. The lids and neck side, there was hyperpigmentation of skin over the eyelids. In the conjunctiva, there was diffuse conjunctival condition with a sentinel vessel at 10 to 11 o'clock position. There was diffuse hyperpigmentation with the florid neovascularization of iris, and there was multiple hyperpigmented scleral patches present in the superior and the inferior quadrants. The cornea, it was hazy and it was edematous. The anterior chamber, there was a variable antechamber depth with 4 millimeters hyphema. There was posterior synechiae present in 6 to 8 o'clock hours with ectropia and uvea. Pupil was slit-like with a vertically oval pushed temporally and not reacting to light. The intraocular pressure, the eye was hard on palpation and confirmed the digitally high IOP. Could not be measured with non-contact tonometry and was 41 millimeters mercury with Goldman applanation tonometry. This is pictures denoting hyperpigmented scleral nodules present in superior and inferior quadrants. With gonioscopy, there was no evidence of neovascularization as was seen. It was a closed angle in the left eye, and the lens showed nuclear sclerosis grade 1. With a dilated fundus examination, there was no view in the left eye. Summary: a 53-year-old female with complaints of gradually progressive painful loss of vision in left eye since 6 months associated with retinous watering. There was hyperpigmentation in the left side of the face with multiple hyperpigmented scleral patches with florid neovascularization of iris. B scan showed large hyperlucent and hyperreflective supranasal mass just behind the lens, extending till the equatorial region. MRI orbit confirmed ciliary body melanoma with no extraocular extension. LFT and CECT revealed metastasis to the liver. The patient have been referred to enucleation and been followed up with chemotherapy and radiotherapy. Uveal melanoma is a discussion. Uveal melanoma is the most common primary intraocular malignant tumor arising from the melanocytes of the uveal tract. Liver metastasis is common with very poor prognosis. Oculodermal melanocytosis is a congenital periocular pigmentary condition that can lead to development of uveal melanoma, estimated at 1 in 400 affected patients. In advanced cases of uveal melanoma, patients may present with secondary glaucoma due to extension of the tumor into the angle, pigment-laden macrophages causing blockage into the trabecular meshwork, or anterior displacement of the lens iris diaphragm. Oculodermal melanocytosis is a congenital hyperpigmentation of the facial skin in the first and second division of the trigeminal nerve. And collaborative ocular melanoma studies suggest that medium-sized tumor can be effective with radiotherapy and enucleation. I like to conclude that by a study that patients with oculodermal melanocytosis should undergo routine ophthalmological examination in order to carefully monitor for glaucoma and melanoma.
Thank you.
Thank you.
Any? Next. Okay. Next, you can. Dr. Samiksha Agrawal can present. Is presenting. Dr. Samiksha Agrawal is not there. Dr. Samiksha Agrawal. Then Dr. Sophia. Dr. Sophie will be presenting on effect of Sophie will be presenting on effect of OCT parameters of uncertain significance in wet AMD treated with intravitreal antibiotics. Right? Yeah.
A very good good evening to everyone. Today I'll be presenting a paper on effect of OCT parameters of uncertain significance in wet ARMD patients treated with intravitreal anti-VEGF. Wet ARMD is characterized by various findings on OCT, likely subretinal and intraretinal fluid, choroidal neovascular membrane, pigment epithelial detachment, retinal pigment epithelial tears, deciform scarring, and loss of ellipsoid zone. And there are also certain other OCT parameters which are multifactorial in origin and whose significance is not yet determined, like pseudocyst, outer retinal tubulations, choroidal cavern, prechoroidal cleft, and onion sign. The aim of my study is to analyze the effect of OCT parameters of uncertain significance on visual outcome in wet ARMD patients treated with intravitreal anti-VEGF. My study design is a prospective cohort study. Duration was from September 2022 to December 2023. Sample size includes 22 eyes of 14 patients. My inclusion criteria include patients, wet ARMD patients having central foveal involvement, and those who are treated with at least 3 doses of intravitreal anti-VEGF. And the exclusion criteria are those patients who have had history of vitrectomy or any significant media opacities. My material and methods there is a comprehensive ophthalmic evaluation was done and baseline visual acuity was noted. The OCT was done and all findings suggestive of wet ARMD were documented. And intravitreal anti-VEGF was given monthly and visual acuity testing and OCT parameters were done at every 1 monthly follow-up. For final analysis, the baseline and 1 month post third dose anti-VEGF visual acuity and OCT parameters were compared. My results, the age of my subjects, they range from 52 to 87 years. The males outnumbered the females, and there are 4 patients who had bilateral involvement. The results, mean baseline visual acuity was 1.29 logMAR units, and based on the OCT parameters, I have a patient who have CNVM, total lysis 18, intraretinal fluid 14, subretinal fluid 11, PED 9. And the results of the uncertain significant parameters, onion sign was seen in 2 patients, choroidal cavern in 1, prechoroidal cleft in 2, and intraretinal pseudocyst in 4. The results comparing the baseline and final visual acuity according to the OCT parameters, there has seen to be improvement of vision in all the findings like CNVM, intraretinal, subretinal fluid, and PAD. However, in the findings, onion sign, there is improvement, slight improvement. However, in choroidal cavern, prechoroidal cleft, and intraretinal pseudocyst, there was no improvement. Discussion in the present study, 2 eyes having onion sign showed visual acuity improvement from 1.55 to 1.24 logMAR unit after 3 doses of intravitreal anti-VEGF. These were also seen in certain other studies. They have also proved the same findings. And the presence of choroidal caverns, prechoroidal clefts, and intraretinal cyst in the present study showed no improvement in the visual acuity, which is also documented in other studies. And conclusion is, amongst the OCT parameters of uncertain significance, only the presence of onion sign showed mild visual acuity improvement, whereas the presence of prechoroidal cleft, intraretinal pseudocyst, and choroidal cavern did not show any significant visual recovery. Thank you.
How many times this onion sign is documented in literature? Is your term?
It was documented in that literature. Which
Where? In which one have you quoted that reference?
Onion sign.
Yes. I have quoted. I have.
This total number of cases were 18.
No, sir. 22 eyes of 14 patients.
22 eyes.
Yes.
So
No,
no,
they were less difficult patients. There were
But
few
good
patients
good
of
effort
better.
in presentation.
No, you have to look for that. Then only you will see, especially in chronic cases. So ideally, to see the significance, you need large numbers. No?
Yes, sir.
Especially
That was a
chronic
big
cases.
limitation.
Like another
actually,
one is
sir.
outer retinal tubulation,
Cohort क्या
ORT.
है? Cohort?
So cohort.
This one क्या है?
So cohort is a prospective study. Like we study prospective.
This is all prospective?
Sir.
Okay, you have selected all cases and just.
Yes, sir.
Cohort. Is it sample? ठीक है.